Hello and welcome to the therapeutic approach to building a stronger body. We have some really great information that I'll be sharing with you today. So let's just go ahead and get started. What we're going to talk about is why we need muscles, particularly for disease prevention and disability. What methods we can use to increase strength, to increase muscle mass for mobility. And then we have a new program that we're implementing here at Morris Health Regenesis, and we're going to talk about that new program. So first of all, why do we need to focus on a strong body? Why do we need strength and muscle mass and all of that stuff? You know, most of us are into our older years. We're not competing in sports anymore. We're sort of past trying to impress with our, swimsuits or whatever it is, how we can impress somebody as far as being physically aesthetic goes. You can still do all of your daily activities that you need to be doing as a person. And perhaps you already do a little bit of exercise, or perhaps you're already walking, you can do your own laundry, you can do all of this stuff. So why do we need to focus on something when you, at the moment, might feel okay? All right, let's talk about that. First of all, we need muscle mass to increase metabolic rate, which we will talk about. We need muscle mass for balance. We need a certain amount of strength to keep and possibly improve our balance. That includes walking and doing daily activities. To decrease body fat mass, because we know that if we have excess body fat mass, we're also at risk for other types of diseases like cardiovascular disease. Improves insulin levels. Why do we want that? So we don't get diabetes or have the complications that come with severe type 2 diabetes. And then just for weight management in general, when you have more muscle mass on you, you tend to burn more calories at rest. So that's kind of cool. Muscle function, that's number 2. So muscle function means that we understand how our body moves. We can coordinate our body a lot better. So that means using upper and lower body at the same time. We have stronger, more flexible muscles. I had a question the other day. Well, I thought it was good to have tight muscles. No, not necessarily. Tight muscles can start pulling at the joints. What you want is flexible, strong muscles. This also includes being agile. So meaning that you can kind of move with whatever's happening in your life as far as everyday movement and function goes. Fall prevention, again, goes with strong, flexible muscles, being agile, being coordination, all help with preventing falls. And then less injuries. So if you have stronger muscles, you're able to recover from injuries better, and you'll actually prevent a lot of injuries from even happening in the first place. So that's nice. Number 3 is mental wellness. So when we're exercising, when we have a better body weight, when we are improving our insulin levels, which can also help with improving hormone levels, we tend to have less anxiety. We tend to have more of a better mental outcome, mental wellness. We have a little bit more self-confidence with the way that we move. We can sleep better, and our quality of life is just better because we can move better, we can think better. So that's why we're doing all of this. That's why I hit exercise as hard as I do when you're in the health coaching sessions with me, because I want this for you. Okay, so what happens when those things don't really happen? We don't really exercise. Maybe we got an injury and we really could never get back into exercise again, or we're just aging. We lose muscle as we age. It's a well-known fact. So how do we grasp this really? There's something called age-related sarcopenia, and it's this progressive generalized loss of skeletal muscle mass and strength and function that's associated with adverse outcomes. So that would be like falls. And if you do fall, you could possibly get a fracture from the fall or some other physical disability from the fall. It can leave you more timid about exercise or more timid about doing physical activity in general. And if there is a severe enough physical disability, it could lead to the increased mortality rate. So even though it's natural to decrease muscle mass as we age, what we want to do, the goal is to very, very, very slowly decrease that muscle mass as much as we possibly can. And that can happen. And the sooner we start with that, the better the outcomes will be. Just by looking at this graph, if you have more physical activity in your adult life and you sort of maintain that physical activity, you have a greater probability of not reaching that disability threshold. If you are already at a disability threshold, the goal at that time is to just maintain status quo. We're just trying to stop that sarcopenia from dipping down further and further. All right. So as I said before, we get older, we lose a little bit of mass, we lose a little bit of strength, and it happens faster the older we get. It's kind of a bummer, but that's why we're having this talk. This happens because the protein in the muscles just break down really fast. They break down faster than they're building up. So that's why exercise is so important, because exercise helps promote the building of the muscle mass, promotes the building of the muscle proteins. What's not so great is that this process is a really slow process. It's very, very, very sneaky. It can start in our sort of 30s, maybe late 30s or so, and then it's generally sort of eats at the muscle tissue so slowly you kind of don't even recognize that it's happening, usually until something happens, an injury, a fall, or maybe not even like not feeling well even. So from a sort of metrics point of view, I have these different pictures. So the picture of this person flexing their bicep muscle shows a healthy muscle. And it shows here that there's the bone that's in the center, and there's this really sort of thick layer of muscle, and then a smaller layer of fat around that muscle. So that's optimal. When we start hitting sarcopenia, the middle portion, the muscle portion, is a lot smaller, and then the fat portion is a lot thicker. So now we're having an imbalance between fat to muscle. So when you're on my InBody machine, oops. All right. And you see something like, you might weigh the same. You might weigh a normal, what's like a normal weight for your height. It'll show a reduced amount of skeletal muscle mass, and then it'll show a higher percentage of body fat mass. And you're like, but I weigh a normal weight. I have a good BMI. I don't look like I have all of this extra percentage of body fat mass on me. Well, that's because it's actually getting into your muscle, which is the bottom picture. So the bottom black and white picture kind of shows this cross section, and on the left is a normal muscle tissue, and on the right is the sarcopenia and all of that whiteness that's sort of getting into the muscle, that's the body fat that we're talking about. So it might not be like subcutaneous fat, very visible. It's actually getting inside the muscle. And it's cause for concern because it does mess with a lot of other different functions that the body needs, such as insulin sensitivity. We need that glucose to get into the muscles to produce energy, so we can use that energy. And if we have extra fat in the muscles, it's very difficult for the body to efficiently use glucose as it needs to, or use energy like it needs to. So then how do we slow the rate of sarcopenia, or how do we not even get into sarcopenia? Well, it's kind of your traditional ways that you think about it. You lift weights, you got to exercise a little bit. But what's not so traditional is that we have this new method that this new machine that's called the Thera-Flex machine, and it helps stimulate muscle mass. So we're going to talk about that a little bit later on in the PowerPoint. But then we also have to watch our nutrition. If we're eating a lot of high fat foods, very little protein, very little vegetables, we're going to get that fat in the muscles that we simply do not want. So one of the first things to do is to take a senior fitness test with me. Some of the members here are pretty good about it. We do it once a year. If you're new to the practice and haven't received a fit test yet, please let me know, call the office, we will get you scheduled for one. So this test, I measure muscle function, that's the strength, power, endurance. How efficiently are you moving? There's a grip strength test, which is overall physical predictor of strength in your body or physical decline. We talk about flexibility, lower body, upper body flexibility. I call it a balance test, but really it's a fall prevention test. I want to make sure that you're not at risk for falls to begin with. Aerobic conditioning, and then a speed walking sort of test. It's some of these tests are a little bit more challenging than others, but it's doable, and it gives you a really good idea of where you're at as far as your functional fitness goes, as far as you maintaining your independence goes. So I highly recommend that you get this test done if you haven't had it done within a year. All right. So most of you are here because you want to move better. The fitness assessment, like I said before, will help give a clear indicator of very important aspects of how you move. This also helps me as a personal trainer to come up with a routine that's personalized to you. Not everybody can have the same exercise routine, nor would I want that for you. And then, as I said before, the fitness assessment, a personalized exercise routine, and the new Thera-Sculpt machine that we have is there to promote you living as healthy as possible, as independently as possible, for as long as possible. So these are definitely some things that need to be on your checklist. So as far as keeping your muscle strong, or even increasing your muscle mass and strength, there's nothing better out there, to be honest with you, than resistance training, than weight training. It is tried, it is true, it's been tested upon over and over and over again. You want quality muscle, you must strength train. There's different kinds of strength training. If you've ever been to one of my Move It classes, I talk about different types of ways to move your muscles, ways to train your muscles. I talk about muscle fibers. I talk about all sorts of stuff. Those of you that take my move the class, you already know about this. This is good, a review for you. So there's strength, and that's the quality or state of being strong and being able to lift a certain amount without injuring yourself, moving from one point to another, moving something else from one point to another with relative ease. And then there's something called power, and that is force plus speed. You need both of these things to be independent and to be healthy and to be safe. So, so strength training is your typical, you're lifting your weights to fatigue. And then power is more like you're moving with a certain amount of force and speed. So it's kind of like more fast-paced movements, typically with body weight, but it can be done with lighter weights sometimes. That would be like jumping, for instance. Not that I want you to jump, not that it might not be safe for some of you to jump, but that would be an example of like a power move, something that's a little bit more fast, which we do need sometimes in life. If you're in the parking lot and a car doesn't see you and it's backing out, you got to be able to move quickly out of the way. That could involve some power. There's something on the ground that looks dangerous. You might have to jump to the side or do something to get out of that danger way. So that's when we talk about using muscle to be safe. So an appropriate fit program to either prevent or reduce the progressiveness of sarcopenia would be strength training 2 to 4 days a week, depending on you personally, resting 48 hours in between training, doing light aerobics or active rest, and that can include stretching and balance exercises, and then progressively training. So a progressive training means you might start out with a fairly easy strength training routine, and then 2 weeks you up that intensity by 20%. And if that sounds confusing to you, don't worry. That's why I'm here, to help you along through this process, because I know all about it and I can help you. So this type of training is what we call prescriptive exercise medicine. This is literally a prescription on what to do, as I said, to prevent sarcopenia or reduce the rate of sarcopenia, to prevent other diseases such as diabetes, hypertension, obesity, metabolic syndrome. All of these things this exercise program will help with. And it's studied and researched and proven true time and time and again. They have this whole idea that's called exercise is medicine, and this is one of the prescriptions for that. So you can consider this like a dose of daily medicine if you really think about it. All right. Okay, so you're probably telling me, yeah, Heather, that sounds well and good and everything, and I get what you're saying, but that's not for me. I already have an injury. I already have arthritis. I really can't walk, let alone start strength training 2 to 4 days a week. You lost me like 3 slides ago. Totally get it. I understand completely. So oftentimes the dilemma is it's not that there's this lack of willpower. It's not like you're not willing to try this. It's more like your body is not complying. Lack of mobility or body pain can hinder the quality of exercise that's really needed for optimal results, that's needed for that prescription medicine exercise to actually work and be effective. And so you might have other roadblocks in the way rather than just, oh, I don't think I can fit it into my day. There might be some significant physical problems, which I completely understand. So that's what brings us today to this new machine that Dr. Chan has brought in to the membership. And it's called a True Sculpt Flex machine, and is a part of this program that I created called a Thera-Flex program. So what this machine does is it helps stimulate your muscles. It helps twist and stretch and contract your muscles without putting it's not high impact. So you're not putting pressure on your joints. It's not jarring. There's very little recovery time, and it helps slowly prep the muscles for better exercise. So you want to use this as sort of a supplement to a very moderate exercise routine. And that's very, very personal towards your needs. So if you're getting little to none exercise right now, you can still be on this machine, and this machine will help prep your muscles. It'll help stimulate your muscles so that you can start getting a little bit of exercise in. So it's only going to your exercise threshold, not mine or whatever anybody else thinks you should be doing, not even what you think that you should be doing. It's really about what your muscles can handle. And that's what we're doing here. We're preparing your muscles to handle just a little bit more in order to start building muscle or preventing sarcopenia or something like that. So if you look here, there's these sort of electronode pads that are yellow. One says number 1 and one says number 2. And they're placed on each end of the muscle. And so when we hook you up to this machine, and when we turn on the machine, there's these electro signals that start activating the muscles. So you're not activating your muscles. The machine is activating your muscles. All right, let's delve deeper into this here. This is FDA cleared. It is fairly safe, but we will get into some contraindications. So this machine is tested, and it does improve muscle tone by contracting the muscles with multi-directional stimulation through an electrical current. Now, the intensity levels vary. We can go to a very, very low intensity level if you haven't exercised in a while, or you already have sarcopenia or something like that. And then you can slowly progress into more of a muscle building sort of intensity. It's very specific towards sort of like the major muscle groups. And these are full contractions. So it would be like if you were to do a leg extension, you would be activating your quadricep muscles. So these electronodes are placed in specific areas to where it would assimilate you doing a leg extension, or it would simulate you doing crunches or oblique twists or something that you're like, no, I would just never get down on the floor and do a crunch. Well, in this situation, you would be able to. The electronodes would do it for you. You will have to be lying down. That's one of the protocols. All right, next slide. Okay, so the benefits of this is that it targets multiple muscle groups at a time. Perfect. That also means that it actually helps build your metabolic rate, your basal rate, how many calories you burn at rest, because you're activating all of these muscles. Again, it helps prevent muscle atrophy, which is sarcopenia sort of falls into the category of muscle atrophy. And then it can, I'm not saying that it will, but it can increase your muscle mass. Typically what it does is it's like a precursor to exercise. So you're really just activating, awakening the muscles, prepping your muscles so it can handle a larger load for exercise. There's almost there's little to no recovery time. I've been on this machine myself, and I can give you some personal testimonies when we get into the questions and answers later on. So I'll tell you about my story about recovery time. This is also used for rehabilitation. Depending on what kind of muscle injury it is, this can possibly help recover the injury faster. People that just can't or are unable to get the quality of exercise that's needed to improve muscle tone, this is a really good viable option. And then it does build exercise confidence. So these are some real pictures of what this machine does. So if you look on the bottom picture here, that's the machine that we have, and I'll show you in a little bit of our machine. But you basically lay down on a bed or one of the tables that we have in the exam rooms. And there's these electrodes that you see. Then they are strategically placed in areas that will contract a muscle. So the origin of a muscle and the attachment of the muscle, not exactly on those spaces, but very, very close. So those muscles can contract, but it doesn't kind of pull on your joints. So you don't feel any joint pain or impact on the joints. You just feel the actual muscle contraction. And these are electrical frequencies. And again, we only go to the intensity that you can tolerate. It is therapeutic. So it's not like a day at the spa. It's not super relaxing because we're trying to activate your muscles. It's going to be therapeutic, but it should not by any means hurt or cause any sort of pain. So there's the stomach one that you see on the top left. There's on the legs, and actually here you can see the stomach too. So let's look at a different picture. I know I'm just trying to show you what this looks like. We have to put these electrodes on bare skin. So if we're trying to increase glute strength to help hip stability and balance, we are going to have to, put those electrodes on the bare skin of the glute muscles. And then what's over it is this sort of wrap, and that wrap keeps the electrodes in place. And we can do the glutes and the hamstrings, the back of the legs at the same time. So you're activating a lot of muscles within 45 minutes. That's the time that is recommended for this machine. So there's the actual machine. Those are those magnetic electrodes that I've been talking about. And then we place it on the muscles. So the prep time, we have to sort of stick all of this on. When I say we, Carolyn's trained in this, I'm trained in this, and Tori's trained in this. And so, one of us will be helping you with this, but it'll most likely be me. And it takes about 15 minutes to kind of just prep you and put all these electrodes on you and make sure that you're as comfortable as possible and all of that. And then the actual therapy process itself takes about 45 minutes. One of the technicians will put you on a pretty low setting just to make sure that you can tolerate the electrical stimulation that's happening. And then if you're like, oh yeah, no, this is relaxing, I feel like I'm a day at the spa, we up it a little bit more. So you almost want to feel like you are exercising, not intensely, but that you feel your muscles. That's the whole point. So when you you'll feel some muscle movement, you'll feel some vibration. You might even feel like this mild twisting and sort of like this turning. And it's just really prepping all of your muscles, awakening those muscles. Again, it should not hurt. it shouldn't feel uncomfortable, but you do want to get yourself at a therapeutic level, because that's what it's there for. It's there to activate your muscles. If it's too light, it's not going to do that much. So there's sort of like there's a little dance that happens there. You might have a little bit of reddened skin afterwards, and your muscles might actually twitch a little bit afterwards. That's what happened to me when I got on there. It does go away. It does not last for very long, although it is a bit of an interesting feeling when it's happening. You do want to drink plenty of water. That is essential. That is mandatory. I don't know what it is. This leaves you thirsty. Okay. Let's get into some contraindications of this machine. Who can use it? Who needs to be cautious? What are the parameters? If you have a pacemaker, you cannot be on here. Arrhythmias, some heart conditions, you may not be able to be on here with. Don't completely write this off unless you have a pacemaker, because we might be able to work depending on the cardiac abnormality, depending on the severity of it. So definitely talk to us. If your skin has an injury to it, if it's swollen, if it's inflamed, if there's a tear in the skin or anything like that, you gotta wait for that to heal. If you've had cancer treatments within the last 3 months, it's not a good idea to put you on here. Your body is still healing, it's recovering from something else. We'll wait. If you have a history of seizures or epilepsy, that I would probably say no, but there might be, if it's minor and it was years ago or something like that, just talk to us about that. If you have metal implants, we need to know. If you feel very anxious or even claustrophobic, because we are wrapping you up in this plastic, not all of you, just certain body parts that are pretty on the lower extremity. But if you're anxious about that, or like I said, claustrophobic or something like that, we need to know. And then also, if you can't lay there for about an hour, please let us know, because we're hooking you in. It takes time to hook you in. So if 15 minutes into this 45-minute session, you're like, oh, my back's hurting, or I can't lay here anymore, or whatever, then you kind of just lost this session. So please let us know. We will try to make you as comfortable as possible. We will try to work with you as much as we possibly can. But if it's like a condition where you just cannot lay down for that long, then this might not be for you. So does this come with a concierge membership? We are allowing all of the members to try 2 treatments for free. That should give you enough information to decide on whether this is for you or not for you. After that, it's extremely discounted. This is a pretty pricey machine. There's a lot of different parts of it that are involved, which is why we can't completely offer it for free, but we're talking a really massive discount. It is recommended that you do 4 to 6 treatments, along with a moderate exercise program, which is when I'm the one that's most likely going to be helping you with the True Sculpt machine. But then you also want an exercise program on top of that, highly personalized. And okay, again, that's where I come in to help you with this. And then we also want to talk about any other ways to help support and promote muscle mass. And so we will talk a little bit about protein powders or protein bars or amino acid supplements, something of the sort to really help optimize this program for you. So you'll have a consultation with me about it. So I came up with this specific program that I call the Thera-Flex Program, and it's designed to tone and stretch the muscles with no impact on the joints, very little recovery time, and it's to help people go into exercise in a healthier state. So many times people want to exercise, or I'm trying to help people exercise, and they haven't exercised for a while and they're like, oh, I felt so good exercising, but then the next day I was so sore. I pulled a muscle, I did this, I did that. So in order to prevent that from happening, I think this machine will prep you to conditioning your muscles so you can start an exercise routine safely, or that you can intensify your exercise routine safely. So due to your muscles working at a higher intensity rate and frequency, it is advised to add in a little bit more protein to your diet, and you can do that however you so choose. We do have Designs for Health that does have some protein powders that I've been sampling, that Colleen has been sampling too. We've been looking into these products, and so you can ask me or Colleen about that as well. And it's just a part of the program to really just help support you in trying to increase strength and muscle mass safely. So I know that there's going to be a lot of questions, and I want to show you these machines back here. So I'm ending this PowerPoint a little bit early, but let's just summarize what we talked about. Muscle loss is a natural part of aging, but we don't necessarily need to get into sarcopenia, which leads into physical dysfunction. So the fitness assessments will really help provide you the information that you need to understand where you're at as far as healthy independence goes. How well you can move, how well you can balance, how strong are you in general, how flexible you are in general. And then after that, it's a good idea to have a resistance training program, because that's what's going to increase your muscle mass, keep your muscle mass, all of that. But for those of you that feel like you need a little bit extra support, then that's where the Thera-Flex program comes into play. That's when you can hop on the machine and you can prep your muscles, you can intensify the contractions of your muscles, and then you work with an exercise routine in conjunction with the program to help at that point really repair your muscles, really prep your muscles for exercise and possibly increase muscle mass. So that's what I want for you. So we don't get into the frailty state. So we don't get into these metabolic diseases, so that you can lead the healthiest life you can for as long as you can. Okay. So thank you so much. Of course, I can help you in this journey. That's what I'm so excited about. And give us a call, give the office a call to get a fitness assessment if you need it. Thank you very much.